Oh, as I was saying, because my camera likes to cut me off, this class, it's 3 classes, they're 2 weeks apart, so I will be done February 27th. This past week we went over a lot of things that we've done good, things that encourage us, things are people that sabotage us, including ourselves, or people that bring us food because that's how they show that they love us, and it's not always good for us because we are further out from surgery, so we can tolerate more foods and we know how to eat more of the foods that we like. So we love food. Don't offer it to us. I know you think you're being nice, and I love everyone that's ever fed me or brought me food, but unless it's like small portion and super healthy and super protein packed, it's probably better that you don't give it to me. What else? How much do they anticipate you will or should lose? Month to month. They never gave me any specific goals. They have a percentage in mind that they want you to lose, and they expect you to lose the majority of your weight the first year and then continue losing for up to 18 months to 2 years out. You generally start to plateau at about 18 months. So they want you to lose as much as possible that first year. At my 3-month appointment, my doctor was not happy with me. I was a little low percentage-wise, and so he was disappointed, and I left kind of upset because he had compared me to his other patients. And when I went back for my 6-month appointment, I did not meet with him. I met with his PA. She explained the situation to me, and it made more sense. And she told me I had caught back up in that 3 months. So she expected me to be at 250 at 1 year out, and I was 255. So she was pretty close. And when I went in to see him yesterday, he was very happy. He estimates I'll lose another 40 pounds in the next 6 months and then gradually start to plateau, and that will be when my plastic surgery kicks in. So that will be more weight loss because I have lots of extra skin right now, and it will also make it easier to move and do some of the more strenuous activities like jumping around. Like jumping jacks are terrible when you have extra skin. So my diet right now, I've finally started cooking again, and I can finally eat yogurt again. So I do a lot of Greek yogurt with my yummy protein granola, which I can use about a half a serving in my yogurt, which would be 5 grams of extra protein on top of what's already in the Greek yogurt. I usually have those an hour before I go to the gym, or when I get home from the gym I'll have one, or if I'm craving something sweet for a snack before bed or something. I have been actually craving yogurt. Yay me. I have lots of protein bars. I'm still taste testing some of them. I'm trying to get back into doing protein shakes just because it makes things easier, and I really need to up my protein. I do lean cuisines when I'm at work because they're quick and easy and I don't have to cook before I go to work. When I do cook, it's usually chicken because I like chicken and I don't like to cook, and so it's quick and easy. And I do taco seasoning on it, or I marinate it in like Italian dressing, or get some barbecue sauce. I try to mix it up, but I'm a picky eater, so it's hard for me. When I eat anything else, it's usually something that my dad cooks. So he'll do meatloaf or roast and potatoes or a bunch of other stuff that's not good for you. My medications, prescription medications, right now I am just on my thyroid, which has been decreased 3 months ago, I think. We're still battling that. When I start meeting with my doctor for the skin issues, I will also be going after some more thyroid tests for a couple autoimmune diseases that usually cause hypothyroidism. Everything else I take is vitamins and or minerals. I take my multivitamin in the morning after I take my thyroid. I take calcium twice a day. I take vitamin D twice a day. I take iron. I take potassium. I take biotin. And I take B12 once a week. I think that's it. I take the iron because I use the gummy multivitamins and they don't have the iron and my iron came back low. I take potassium because we ran blood tests and my potassium came back low. Both of those are back up to normal with the medication. I have to take my meds 4 times a day because you can't take the Synthroid with the calcium or within 2 to 4 hours, and you can't take the iron with the calcium, and so that splits it into 4. It's a pain. I still have a hard time swallowing the bigger pills like the calcium or the antibiotics when I got my wisdom teeth out. I cannot stop taking my vitamins though because within a week I get sick. I was terribly sick 2 or 3 times in the last month and a half. When my dad went into the hospital, I was staying up there, so I was not steady on my vitamins. So, like I was trying to say, when I got my wisdom teeth out, the antibiotics were big. I would have to break them in half and take them in 2 pieces. And because it took so much effort to take them and it was making me nauseous because they were too big to take, I just couldn't bring myself to take my other pills. So I stopped taking them and I got sick within a week. And I was sick. I got spiked a fever here not too long ago. So, spiked a fever at work. It was a 101 point whatever. Stayed in bed for about 30 hours. And rode it out for 2 days and was good. Started taking my vitamins. And those are the only times in the past year that I've been sick. And that was all like back to back. It was a bad month for me. It was just one thing after the other in December. But things are good now. So, I think that's all the questions. The last question I have is from my favorite aunt, and the question is, who is my favorite aunt? And she should know that because she sent me most of these questions from herself and her fabulous coworkers that have been too scared to ask me to my face. For the record, I do not get offended. If you want to know anything about my weight loss or the surgery or the skin surgery or anything, I don't care. I'm an open book. Go ahead and ask me. Leave comments below. I'll link my Facebook. You can look me up there. Friend me if you want. Message me. I'm okay with that. I have a Tumblr. If you would like to follow me on Tumblr, let me know and I will give you my URL. Ask me questions. I enjoy answering them. I love helping people. I had a ton of help from people that were either going through this at the same time as I was or shortly out, post-op, and I've mentioned them in other videos, so go back and watch those and get the links to their blogs and our support groups. If you're on Facebook and you've had or are getting bariatric surgery, there is Bariatric Pink Ladies. I am one of the admins, a couple of my good friends, one that I actually know in person, I went to school with. We have the same surgeon. We're in this class together. We are both admins. My friend Krista. There's a bunch of wonderful ladies in the class, in the support group. So I recommend us. We're awesome, and we are very open. So if you have questions, you can ask them in there also. And I think that just about wraps it up. I will probably do another video after I speak to the surgeon and get some more information on that, and I will keep everyone updated as much as I can. And if you want more updates, let me know. I'm perfectly fine with updating you personally, like my dear Aunt Mary. So, I'm going to end this video by just taking a few seconds to thank all of my amazing friends and family and the people I've met along the way. I've had a huge amount of support, unbelievable amount of support, and my family especially has definitely been there and stepped it up and never failed to let me know that they're proud of what I've done and how far I've come, and that includes the friends that I consider family. So thank you everybody before I go getting emotional. I will never be able to thank you enough. I can't wait to see what the future holds and I will talk to everyone soon. If you need anything, let me know. I'm here for all of you, just like you've all been here for